Immunization coverage in Kenya, it's about 80%. So we're still saying that one out of 5 children are not being reached with the immunization services and the vaccines. So it is very important that various players who are working, or let me call them immunization stakeholders who are working in vaccines and immunization, should do much more, not only with regards to addressing the system-wide barriers, but also moving into do some advocacy-related intervention and initiatives to ensure that children are able to access the life-saving vaccines in the country. Number one, we need to see how we can be able to target the policymakers or the parliamentarian for that matter, and be able to work with them because they yield a lot of influence at the constituency. How we can be able to work with them to be able to influence a responsive policy that is going to respond to the needs of these children, specifically with regards to immunization. The other thing is to also engage the media. The media is very key with regards to dissemination of information to the public. It will be very important for the public to know the value and the importance of immunization, so that we are able to reach out to the mothers who are a bit slow with regards to taking their children for immunization. So the media becomes a key partner for us as Kanko. Maybe the other thing is also to engage the government very, very closely through the Ministry of Public Health and Sanitation and the Division of Vaccines and Immunization, to work with them during the current review of all the health legal instrument in this country, to ensure that the vaccination beds or immunization beds are well captured, and also working closely with the government to ensure that the government develops an equity strategy that is going to focus on the hard to reach, especially Coast Province in Kenya and Northeastern Province, which have lagged behind since independence. And maybe the very last thing is also to engage the civil society, bring together the civil societies who have an interest in vaccines and immunization, and all those coalitions like the MNCH coalitions who are working in, the MNCH coalition who are already addressing mother, child health and newborn health, to see how we can be able to work together and drive the advocacy agenda, and also be able to profile together, also with the support of the media and the champions, immunization champions, the value and the importance of immunization in this country. Well, number one, child health, it's something that I can be able to identify with at a personal level with regards to my value. That is the first thing. And the second thing is that if you look at the immunization coverage in this country, having in mind that immunization is definitely a best buy, and also trying to look at the value and the importance of the same with regards to child health, that's really pushes me to be willing to work in an area that I feel still there are gaps that need to be addressed. Also, for the few issues or the few barriers that exist with regards to access, it does provide an opportunity for us to be able to make a difference in reaching those who are not able to access some of these vaccines. Working in the child health and immunization and vaccine present an opportunity for us to be able to do something that is meaningful, that is very important in dealing with the child mortalities in this country, and it's something that definitely will make a difference and be proud of.